Good morning, everybody, and welcome to today's event. With me today, I have the CFO from NeoDynamics, Aaron Wang. This event today is a pure Q&A session where Aaron will take us through the latest development during Q1. Just a couple of practical issues, and welcome to the audience. You're more than welcome to post your questions during the presentation. And you can do that by posting your questions in the field below the video screen, and then I will forward the questions to Aaron. And due to the character of the event today, a Q&A session, please post questions immediately if you have some for Aaron. So with that said, welcome to the audience, and welcome to you, Aaron, and please carry on.
Yeah. Good morning, class. Nice to be with you. Seems to be on the line. Is it coming from mine? Oh, there we go.
Yeah. Sounds very good.
Okay, excellent. No, thank you and good morning. Very nice to be here with you again today. And I'd like to just run through the Q1 interim report, talk a little bit about what we've been doing in the quarter. Talk a little bit about the corporals and the deliveries into our centers in Europe, a little bit about the studies, some feedback we got about the product, which is excellent. All feedback is very welcome, but in this case, it's been very positive, so it's even better to share with you all. And also just what we're doing this year after Q1 into Q2 and for the remainder of the year. So if I could just start with, we had some quite minor sales in the first quarter of the year. Certainly nothing significant, more just kind of small sales, mainly related to our FlexiPulse needle in Europe. We press released that our corporals went out to almost 30 centers that worked with the FlexiPulse needle in Germany and the UK. And that's really good news. We're very happy to start. We had sort of a minor postponement of deliveries last year, and we're happy to get them out again. So we're waiting now to see how the corporals is received from these centers that are now piloting the product. I'm waiting for feedback, basically. So we're looking forward to receiving some. The feedback that we've received so far, the needles went out, was very positive. I think one of the things that we're pleased to see is that, whenever you carry through a study, whether it be clinical or otherwise, you kind of hope that the results reflect reality. And we're pleased to see that one comment came back from one of the radiologists that the yield in our corporals was actually the same as the yield in the bench study. So that's great to see, and we're very pleased that clinical practice is playing out into the benchmark studies playing out into clinical practice. So very pleased to see that. One question that came up was how is COVID continuing to affect the business, if at all? And one thing that we noticed, during the COVID pandemic, obviously we couldn't get into hospitals to be able to showcase our product. Now, we can. However, what we've seen is that hospitals and the like have much tighter budgets, which means that they are resource constraint to a degree, and they have to focus on the things that they know and the things that they're doing. Our technology is quite innovative, quite new, so they have less time to learn. But one of the good things about our product is that it's very straightforward. It's a one button click to use, and for that reason we see our ability to add value and to propose a solution to the current methodology as hopefully quite seamless. It should be noted that with our product you only need one person to operate it. You don't need a big team, and actually to set it up is very, very quick. I mean, some of our competitors can take up to 10, 15 minutes to set up. So yeah, our product is easier to set up and quicker. I just wanted to cover a little bit about the studies that we have been carrying out. We've just finished one, which was reported at the Society of Breast Imaging last week, and this was a German study. It was presented. We have a 93% efficacy rate in hard to reach lesions, which is a fantastic result. And we also have the UK COMPOL study, which is ongoing. And we actually restarted it towards the end of February with a new principal investigator. And we also adapted the inclusion criteria, which means that we have more uptake of patients. The study is meant to be 400 patients. And so far since February, we've passed 100 patients, which is a very important and we believe a very good milestone, which shows there is obviously a market for our product. So yeah, there's some feedback on the system itself. I mentioned better yield. Also, it's easy to handle, less insertions. It's also more patient friendly. And another comment we received was that they can actually take more samples and better samples in the lymph nodes at risky places, which is also good. I mean, I keep getting asked the same question about sales. That's an important thing to address. And with the medical devices industry, I mean, it is a slow burn. I think it's slower than some investors kind of want, and it takes time, especially as we're a quite small business. I mean, to bring a product like ours to the market, it takes years, and we really see that we're now at the final stages of it. So very much watch this space in 2023, and I very much believe that the second half of the year will start to show some sales. We're kind of entering the summer period now, so things might be a little bit quiet, but certainly in the second half of the year we should see some uptake. And I mean, I've talked a lot about feedback, and I just want to share some more feedback of the two congresses that we had in the US. We had some really positive feedback from radiologists, and one of them actually. So there was our booth, and there was our competitors to the left and the right. There's some very big players in the market, and I mean, by the end of the Congress, it was only our booth that actually had people. I mean, the majority of the people, and we had a lot of people, clamoring to test the device. And one of the radiologists actually came by and was like, "Look, I've heard great things, and all my colleagues are talking about it. Can I try it?" And she went through and tried the product itself, and she was just like, "This is awesome." And that's really strong feedback to receive directly from the people that will be using it in the US. So in terms of how our commercialization is panning out, I mean, we see it panning out in the way that we envisaged. I think one of the things that we notice is that the complexities of the system, the reimbursement system, the insurance system, and also getting ourselves into the hospitals is ever present. That being said, we have really good experienced people on board in the navigate and penetrate that. So what I would like to kind of finish on is cautious optimism. So we're very excited about what we're doing, but ultimately, we have constraints that we need to work within. We can have radiologists and breast surgeons that are very excited and very happy to try the product, but ultimately there is a process that follows that, and that is purchasing departments. That's different committees that need to, review the product. So, but so far so good, and very good news. Although we can't necessarily see it play out right now in the financials. We anticipate it to do so later on in the year.
Good, Aaron. Thanks a lot for updating us. And well, as you mentioned, you have more or less everything in place: the product, the organization, and you also chose what markets to do first. Just to dwell a little about Europe, because there's some small sales in Europe. Is it fair to say that the run rate you have now, and I think it's more or less the same in Q4, we will see different figures when we enter the second half of 2023. Because you've been in the market for a while, hospitals and clinics have been testing your equipment. You came out with this press release regarding products and delivering times that are less now than before. If you could on that, and then we could take a question from the audience afterwards.
I mean, in terms of run rate, we've maintained a fairly stable run rate. We've obviously, as part of the commercialization, we have people on board in the US, and we now have a sales organization which is essentially led by Matt Kolpois, who's the CEO of Inc., and we have the 2 salespeople that fall underneath him now. Most recently, we hired another gentleman who's also extremely experienced and is in the same sort of network as Matt. So, but in terms of run rate, our Q1 run rate was slightly higher than perhaps in Q4 in terms of other external expenses. I mean, as noted in some of the analysis that's come out since we've published our Q1 report, I'm pointing kind of more towards Redeye. We have kind of one-time costs in there that relate to sort of ongoing exploration of, financing activities this year. I don't anticipate them to be reoccurring, and how we treat them in the P&L will be ultimately dependent on how that plays out for the remainder of the year. So our underlying run rate is very stable.
Yeah, good. Okay.
Obviously, the activities that we carry out outside of our, I would say, our normal day-to-day operations may contribute to that. But again, you probably see a reversal of that later in the year.
Good. Thanks a lot, Aaron. Then there's a question here from for one participant. It goes more or less the same way. If you get this very good feedback, and you stated that in the beginning, how fast should we expect that to translate into orders? I think that's a very good question.
That's a great question. If you ask me, I mean, I'm a very positive person, and it's quite unusual for a CFO to be so positive. And we're normally, putting the brakes on, slowing down, and not being overcommittal. I would certainly think. I mean, the pilot studies in Europe tend to run. I mean, we've shortened it with 3 months. We've brought it down to 2 months. Ultimately, the US is a completely new market for us, and we don't know exactly how that will translate in terms of the timelines for uptake. And alluded is that although you can have the kind of primary caregiver being extremely positive, there are other complexities to work around, especially when you're dealing with slightly larger hospitals. The good thing is that a lot of these a lot of sway. I mean, if they want something, they can usually push it through. And that being said, our product falls underneath the kind of cap level that would require a bigger discussion within a hospital setting. I mean, when we talk about pricing. So, I would hope that once we have a green light from a hospital or university center, within a quarter we would start to see something. It's just a case of when we get that green light.
Yeah. Of course, and you keep pushing in Europe, as I understood.
Yeah, absolutely. I mean, there are two. It's I can't emphasize enough. They're two very different markets. Europe is, I would say, and I've said this before, it's more cost containment. It's more stable. It's more, I would say, kind of run of the mill. Kind of just it turns over. I mean, we will see positive developments there, but certainly we won't see the type of expansion that we expect to see in the US.
Are you able to leverage on those studies you did in Europe, both in Germany and UK, for US, because you got some pretty good feedback, both tangible and intangible. Could you elaborate a little more on that, Aaron, and what those data will provide for your organization in US?
Yeah, that's a good thing to point out. I mean, our studies and our clinical trials in Europe have been the foundation of what we're doing in the US. I mean, the world is a big place, but in the medical devices, and specifically in the niche that we're looking at, actually, it's quite a close community. I mean, the people taught, breast surgeons attend congresses from Europe, in the US, in Asia. They all kind of get together, and it's quite a close-knit community. So everything we're doing in Europe will be a building block to our success in the US. So the fact that we have such good results from our studies here in Europe is only going to be a great thing for the US.
Good. And then there's a little more technical question here regarding penetration of US. So do you expect when you enter into a clinic and they want to try out the product more or less the same way as you have penetrated the European market, that they decide to take your FlexiPulse, and just for the audience, NeoDynamics decided to use FlexiPulse as the door opener in US, and then in another room they will still use the same method as always. Maybe you could elaborate a little on, Aaron, that you use FlexiPulse as a door opener. You use it for the armpit, and today you at the current stage you don't have alternatives besides surgery. But maybe you could comment a little on your approach towards these clinics and what you expect, if you have any feedback already.
I mean, the feedback is very early now, but what we would like to see is that there's a conversion of the, I guess, the invasive procedures that we see today with the surgery in the armpit to using our product. I think that the value proposition of actually having it in a setting such as an office where, you know, one person can control the needle and go in and do the sampling, as opposed to sending somebody to ER and actually opening up the armpit. We see that, you know, we will hopefully take that market from the existing methodology. I don't think that it will be used kind of in parallel. It will be very much, you know, we see the benefits of using your product over the complexities of surgery. And also, I think it's worth noting that, you know, with surgery comes complications post-surgery, you know, lymphedema, all those kind of things that, you know, can be a consequence of quite invasive techniques. So we hope that, you know, once we gain traction, doctors, radiologists, breast surgeons will see that actually the outcome for the patient is much better. And it works for them. I mean, they'll be able to see more patients during the day, you know. And it's also a resource thing. I mean, I alluded earlier to COVID and how hospitals are very resource constrained right now. And being able to have one person do the procedure rather than a whole team of people going in and doing it surgically makes absolute sense for us. I mean, if you can get through patients, multiple patients a day using our procedure, you're not having to block out time, you know, for other procedures that doctors need to perform.
Yeah, and by that they can do other treatments of other diseases. So actually, you relieve them in a greater sense than maybe first anticipated.
Right, exactly.
So, good. I don't know if there's more questions from the audience right now. Otherwise, of course, I always have a couple. Let's see here, Aaron. What we addressed Europe in a broader sense. We addressed the US in a broader sense. Is there anything else we should be aware of right now? Anything else you want to elaborate on just before?
I mean, my job here is obviously to set expectations and to do it in a way that is, I would say, reasonable and also reliable. I mean, the product itself is quite, I have to say again, it's quite a complicated product with a lot of moving pieces and very, very high tolerances. And when you're creating something that hasn't been, I mean, it's not been on the market before, I mean, you're going to find that there are teething issues with the product. I mean, that's quite normal. And I understand there's a general, I would say, impatience, maybe a bit disappointment that, you know, we're not doing things faster. But I have to explain again that it's so critical that we do it properly and that we do it with quality and we do it with our patients in mind, because we could never go out with a product that is suboptimal in a new market, because it would destroy the product and it would probably destroy, you know, a lot of what we've done. So these ongoing improvements that we're making and the delays that we've faced are all for a very good reason. And I appreciate that shareholders and the like and investors are saying, when can we see results? And we're excited to see results, and I'm excited to see results too. And they will come. They will come. They will absolutely come. But in good time and with proper order. That being said, the markets, as you know, Klaus, are very tricky right now. There's a lot going on in the US. There's a lot going on in the Nordics. That being said, I was given a really good piece of information from a different investor, and that's if you have a good product, regardless of the market conditions, if you've got a good product to sell, you'll be okay. And we believe we do. And the feedback we've received is positive too.
Yeah, thanks a lot for that. There's a final question here. Does the patient have anything to say in terms of treatment, Aaron? And that goes for both the European and US market?
I think they will have. I can only recount on. I mean, when you go to if you go to the doctor and you tell the doctor, look, I think I have this, and this is how I think I should be treated. I think that will always be a conversation piece with the caregiver. It's if they have a preferred way of being treated, I think it's ultimately down to the doctor that is looking at the patient saying, well, we think this is best for you, or we think that's best for you. But if the patient goes in and says, look, I've seen this technology and I think it's great, and I've seen the results, and I would really feel that this would be something that I could benefit from, I think the doctor would have to take that into account and have to think about it. I don't think the patient in any sense is ultimately decides on how they're treated. I think they have to leave it to the doctors to give their professional judgment. But certainly if there's a preferred method, then the doctor should take that into account. Absolutely.
Yeah, you can say, especially in the US market where you have this insurance system put in place, actually you both save time in terms of surgery's time compared to the guy who carries out your examination, but still, you have less side effects in your product compared to surgery. So
well, exactly, that's it. And even if even if maybe one or the other, let's say the patient, the doctor is pro and the other one is against, I mean, we see it as being a benefit for both. I mean, there is no like lose case scenario here. It's beneficial for the doctors. It's quicker. It's time effective. It produces better quality samples. I mean, it's all of the above. And then for the patient side of things, I mean, it's local anesthetic. It goes in and then it comes out. I mean, it's not you're not sitting on an operating table. So at least for me, that would be my preferred way of going. So
I would prefer the same. Yes, by that said, Aaron, I think time is more or less up. As always, it's really nice to have you in the studio and talk a little about what's going on. And as you mentioned, we have to be a little more patient, but you are working the right way and everything is set in place. So by that said, I would like to thank the audience for the questions to Aaron and listening to this event. And you, Aaron, thanks a lot for participating, and hope you get a great weekend. By that said, I will end this session. Thanks a lot.
Thank you.